If you find yourself struggling to gain control of your morning low back pain, this video is for you. Sciatica, sharp pain, stabbing, tingling, aches, tightness, whatever you might experience, I'm gonna give you two very specific things that you must follow if you ever wanna get control of your morning back pain. The first major morning back pain mistake you must avoid is treating the symptoms right when you get up. We have a habit of wanting to get away from the pain, right? We don't want to experience it, of course. So what do? We try to start doing things that help the symptoms, hopefully lowering them. Some stretches that your PT gave you, maybe it's some yoga stuff, some rehabilitation exercises, some core training, maybe it's some Pilates, maybe it's just taking medication, whatever it might be. The worst thing you can do is try to start treating the symptoms first thing in the morning. There are so many factors to morning back pain. It's not just the bad position you may have slept in, lack of pillow support, mattress support. Oftentimes it's what you did the night before, the habits you did the day before led to an increase in sensitivity. If you're on a chronic situation where every day you're waking up with chronic sensitivity in the morning, there's a deeper issue. This is something that I focus on heavily inside of my Pain Relief and Strength Accelerator program. So if you need help, you can always look at that resource there. If not, I would highly suggest you to look at what are your habits, what are your daily habits, what are making your pain worse. First avoidance rule is to don't try to treat the symptoms first thing in the morning. Now, before we jump into point two, odds are, besides your morning back pain, for whatever reason, your exercises or your workouts are causing you pain during the workout. Maybe it's afterwards, maybe 12, 24 hours after your workout, your pain is super intense and you can't figure it out. I've got a free guide that you can check out. Go to fitnessforbackpain.com/pain-free training. I give you everything you need to break down what you're doing right now in the gym as far as your workout goes, exercise choice, core training, volume, intensity, frequency, reps, sets, and says, hey, this is the most simplest way of creating a back-friendly workout for you to follow. Go to fitnessforbackpain.com/pain-free training. Let's jump back into the video. The second rule you've got to follow when it comes to morning back pain, stay away from any major pain triggers. We often do things both consciously and subconsciously first thing in the morning due to a lot of different things. Maybe it's habits or routine, pathways of thinking, pathways of just moving our bodies and getting our day started. We just don't really think twice about it. We just do it. Unfortunately, some of these movements, some of these activities or habits or routines start to pick the scab of that injury. My biggest thing that I try to focus on with people first thing when it comes to morning back pain is, hey, for the first hour to 2 hours, let's look at your list of things that really poke the bear of your injury. What are the things that really make your back pain hurt when it comes to first thing in the morning? A safe place to start is by making a pain trigger list. What are the things that you do on a daily basis, activities, movements, that pick the scab of your injury? If you can identify some very specific ones, maybe some major ones like bending over isn't really bad, but it's kind of bad midday. First thing in the morning, for whatever reason, it's a really bad thing. You want to say, hey, prioritize bending over first thing in the morning. And there's lots of ways that you can structure your morning that eliminates a lot of that bending first thing in the morning. This is where the nuances, this is where like the individual approach really comes in. What I really focus heavily on inside of my Pain Relief and Strength Accelerator program with my students is what makes them unique. What is unique about their morning routine? What is unique about their morning sensitivity, their symptoms, all unique to each individual person. What you have to do is become almost like a detective. Look at your morning routine, look at the habits, look at the things that you can and cannot change, and the things that you can change. What are those things that are actually making your sensitivity worse? A good example for me early on in my back pain journey, my morning routine around getting dressed. Shoes would be on the ground, pants or shorts, drawers on the bottom, socks and underwear go up top. At least that's what happens in my house, right? I would always spend my mornings bending over, grabbing my shoes, bending over, grabbing my pants, bending over, putting my shoes, my socks, and my pants and my shorts, getting dressed and going throughout my day. So I'd spend a lot of my early morning time bending over and creating a sensitive situation. 1, 2, 3 times of bending over really ignited my sensitivity, and that set me up for the rest of the day. What I had to do is I had to optimize my morning routine. I was feeling my best. It wouldn't have a lot of sensitivity. I had to pull my clothes out for the next day and set them up higher. Then I had to sit down and put my shoes on sitting down or taking a knee on the ground or pulling my pants on when I'm sitting on the bed. Like, there's things that you can do that will adjust how you're setting your body up, bending, triggering, picking the scab of your injury, that will give your morning opportunity, or give you an opportunity in the morning to dial back how much you're pushing in to those sensitive movements. But most people just don't really think about that. So the best thing you can do is take the first 2 hours of your day and eliminate any extra stuff that you do trying to treat the symptoms. Then focus on pain triggers. How much of the negative, bad movement that I do, that I have to do to get ready, take showers, put clothes on, shoes, socks, whatever it might be, how can I change and modify these things to not be such a trigger for me? How can I adjust my routine, adjust my habits to create a healing environment rather than a scab picking environment first thing in the morning? If you commit the next few weeks, few months, focusing on those 2 biggest mistakes that you might be making first thing in the morning, I can guarantee that you'll find some room for some decreasing in your sensitivity and kind of open your eyes to other opportunities of getting long-term relief. Obviously, back pain is multifactorial. There's a lot of different elements to it. You might exercise, you might add exercise, maybe exercise causes pain. And if it does, I want you to have a free guide that will now focus on the exercise portion of your chronic back pain relief journey. Go to fitnessforbackpain.com/pain-free training for my free guide, where I map out exactly how you should be structuring, building, and executing a workout that is back pain friendly. Exercise choice, from volume, frequency, reps and sets, core training, everything you need to make sure that your workout is not the thing that's actually causing your morning back pain to be so intense. Go to fitnessforbackpain.com/pain-free training, and I'll see you on the next episode.